one speaker to arrive. So we may have to switch the order up, but we're going to go ahead and get started so that we maintain, because our goal is to keep this only an hour for the evening. So in order to do that, we wanted to go ahead and make sure that we get started on time. So I'm going to start out and share my screen, I think. Okay, so hopefully, oh, there we go. Hopefully everybody can see that. So we want to welcome you to the Pitt County Coalition on Substance Use, our first coalition meeting of the year. My name is Jennifer Matthews, and I am the Drug-Free Communities Grant Coordinator for PCCSU. And I'm going to let Lily at least introduce herself. She'll be speaking later, but Lily Malpas is the Executive Director for PCCSU.
Hi, thank you all for coming, and I look forward to sharing what we're doing in just a few minutes.
Okay, sorry, I just got apparently there is an emergency. We have somebody from GFR that will be attending, and apparently they are currently attending an emergency. So we're hoping that they're still going to be able to join us. But we still have at least one of our speakers who can share some information with us. But before we do that, well, my computer's not wanting to work tonight. Lily, can you see anything on the screen? Is it just white?
It's just white. So I can see the title page, but I can't see.
All right, well, let's go to this. There we go. All right, so we're going to do our welcome, which we just did. And then I'm going to set the stage a little bit and present just a couple of slides on some substance use data during the pandemic. It really does set up the rest of the meeting for today. Hopefully, Battalion Chief Anderson will be able to join us from Greenville Fire and Rescue. And then we also have Dr. Erin Roberts from the ECU Family Therapy Clinic. And then we will get a chance to hear from Lily to see what is PCCSU doing. And then we will have some time at the very end for some questions. So I just want to set the stage to get us, at least sort of oriented to what we're going to be talking about. So during the pandemic, lots of national studies identified the increase in alcohol use in all populations across the state, across the country. And this was consistent in North Carolina. Because we don't have local data for use or consumption to show the use levels, one of a secondary indicator is looking at alcohol sales. So what you see here is across the bottom is the month and year. So basically from the time the pandemic started until January of 2022, and you can see the change in alcohol sales, the percent change in alcohol sales over that time period. And what this is basically showing you is the increase in alcohol and purchase of just liquor. This is only liquor sales from retail stores, outlets, I should say. And then you can, and it's the difference between this year and the same month the previous year. So when you're looking at March of 2020, that increase, which is like 17.5%, that means that alcohol sales have increased 17.5% compared to 2019, March of 2019. So you can see that. Now, I think we can all see from this that we are at an increase of sales across the board, right? But what I wanted to do a little bit further is to break it down by year, because I think this actually shows you a little bit more than just the across the board, the timeline. So in the blue is 2020, in the orange is 2021, and this one little gray dot right here is 2022, because we only have January 2022 data. So when you're looking at the blue, you can see the beginning of the months, January, February, March. it's increasing, but we see that steep decline in April. And if you remember 2022, I mean, I don't want to bring up terrible memories, but that's when everything shut down. So there was no restaurants, only, you know, necessary things were open. So that's where that steep decline comes from. And then you see that it just increases through the summer months. And then it sort of, I mean, it just kind of goes up and down for the rest of the year. But while it fluctuates going up and down, it does stay at least, you know, 10 to 40% above sales from the previous year. And I will tell you, and I didn't do a chart of this, but most of this increase is from the retail side. So looking at purchases from retail stores, this is not mixed beverage. So what you would get from like a restaurant or a bar, it's really sort of the driving it is the mix, the retail sales. And then when you're looking at the beginning parts of 2021, I think obviously this sharp increase, I mean, it's almost 50% in sales increase. And it's a little jarring, but if you remember, also in April of 2020 was that really low, right? Where everything was closed. So you would expect to see a pretty big spike in the same month in the next year when comparison, because of that, you know, everything was shut down and you see that change. So, and then of course the steep decline because things started to, at least in a little bit, bars and restaurants started to get creative in how they were selling alcohol. And even though everything was shut down in April and bars and restaurants should not have been open, there were still some alcohol sales going on. You know, informally, I've heard some things about how that's occurred, but formally, I've never seen any sort of records for it. But most of it, very little of it was that mixed beverage from bars and restaurants. Instead of doing a chart for the opioid data, I just wanted to show you the opioid action plan, or I'm sorry, the opioid action data dashboard. If you're not familiar with this, you can just Google NC opioid dashboard and you can find it. It's really amazing and giving you very specific data related to opioids, and you can get it by county. So I just want to show you a couple of data points for Pitt County, and that is ED visits. First of all, I'll point out right here in the middle, it says that our rank amongst other counties is pretty high. So this is drug overdose ED visits. You can see it, Pitt County is definitely higher than the state, and really with the exception of, what is this, 2018, remains above state levels for ED visits. And then up here at the top, you can look at deaths by county, and you can just kind of see that we just fluctuate up and down, but in general, it is increasing and has been increasing. You can see that the pandemic started in 2020, and you can see that sharp jump. And then you see this drastic decline in 2021. That's definitely not consistent with national data. And I've tried to figure out what's going on, and I just haven't had time to dig a little deeper into the data, but nonetheless, we do rank relatively high when compared to other counties in North Carolina. And the only other thing there's lots of data points that you can see up here, but I wanted just to point out community reversals. And this is for naloxone, and this is just you have to go in and report that you have done a reversal, and there's ways in which you can do that. But you can see in Pitt County that the community reversals and the number that has been pointed out is higher than the state overall, which is both good and bad, right? Like, you hate to have the reason for the reversals, but at least you have them. So that's just some of what we've been seeing related to opioids. Just like with alcohol, opioid overdoses, opioid use has definitely been reported as being increasing during the opioid pandemic. We've seen the highest number of overdoses that we've in recent years during this time. And so I was hoping that we could get some more localized data to take a look about really what's going on in Pitt County, and hopefully from these frontline people who were, doing the calls or responding to these calls out in the community, but also people who work in as a mental health providers in the county that are addressing some of the mental health issues, which is a direct link to substance use. So I'm gonna skip over the trends in EMS because they are not yet on the call. So, and I'm gonna go straight to trends in mental health services. And we are fortunate enough to have Erin Roberts with us, and she is the director for the ECU Family Therapy Clinic. I will let her tell you a little bit about the Family Therapy Clinic and what all they offer, and then give us sort of an overview of some of the things she's seen in her clinic. So I will stop sharing my screen, Erin, as soon as I can get my mouse.
Okay.
And it is all yours.
Great. Thank you so much for that introduction, Jennifer, and for asking me to be here today. I'm going to quickly just share my screen. Let me go ahead and share this and go to presentation mode real quick. Okay. All right. So what are you all seeing, kind of notes and everything? I want to make sure it's full screen. What is it looking like from here?
Yeah, we can see everything.
Oh, see, okay. All right, let me see if I can use the slideshow feature. There we go. Is that a little bit better?
Yes.
Okay, good. All right. So thank you all for having me here today. So yes, I'm the clinic director of the ECU Family Therapy Clinic, and we're located on 10th Street. We are a part of ECU, and we are one of the mental health clinics that also function as a training clinic for our master's students in family therapy, and then also for our medical family therapy students practice here as well. And we've been in the community for over 25 years. And I think some of the important pieces, just to piggyback off of what Dr. Matthews has stated, is that we at the Family Therapy Clinic have been seeing kind of the effects of the pandemic, but also to give the information too that because we are a training clinic, we, really are conscientious of making sure that the level of what people need matches the expertise of the therapists that are there at the time, right? So in particular with our training, we might not take on really a lot of substance use for substance use treatment. We really don't do substance use treatment at the clinic in particular. We would refer out to the specialists in that field. We would refer out to those who specialize in chemical dependency. And then we might work on the relational issues kind of within the family and see individuals on different relational aspects or different mental health features. But I just wanted to kind of give that preface too, so you can know a little bit more about what we do. And certainly interrupt with any questions that you might have about the clinic or what we do. So here's some general information. So we do see community members and students and have been doing so for over 25 years. We are a training clinic for master's MFT students and PhD medical family therapy students. And so we have about 12, we have a cohort of 12 master's students in their clinical year, and that's their final year of their master's program. We really don't have them see clients before then because we have a very rigorous program. We want to make sure that students are trained prior to ever seeing a client. And then they are also given a lot of supervision. So 4+ hours of supervision, clinical supervision with each, with their faculty supervisors. So we also have 5 PhD students in their first year of their practice, in their first year of their PhD program, which is their clinical year. And then we have 4 faculty members that are also clinically active in the clinic. So another important feature, I think, for this conversation too, is that we operate on an income-based fee. And that is to, make sure that we can see that income is not a barrier for people to be seen at the clinic. And we have been fortunate over the past few years to have received a few grants. The Vidant Community Benefits Grant has been one of them, to be able to support the clients in the clinic, so that they're actually we go down to $10 a session for clients that are make less than $10,000 a year. But we realize that even that could be too much, particularly if someone's needs, they might be needing to be seen weekly, which is about $40 a month. And so that could be too much for someone. And so through that grant and through some others that we have received, we're able to waive that session fee for them. So it allows us to see a wide, like, socioeconomic people from a wide variety of socioeconomic backgrounds. So was there a question? Oh, sorry, maybe I misheard. Okay, if you don't have a question, I'll keep going. Okay, all right. Okay, so we do offer in-person and telehealth services. Prior to the pandemic, we did not offer telehealth services, so that has expanded kind of what we're able to offer at the clinic. At the pandemic, we switched very fast. We actually had 0 days of closure at the clinic. We switched right from in-person to telehealth services from one day to the next in about mid-March of 2020. And prior to that, we were not able to have to do telehealth based on some accreditation standards that were then changed because of stay-at-home orders with the pandemic. So we also have a comprehensive intake process so that the client's needs match with the level of the experience of the therapist. So any questions on that so far? All right. Okay. So here's just kind of a brief kind of overview about the pandemic and what we have seen. And to say too, that this is just like a small snippet, a corner of the world in Greenville. And we have, many others in community mental health, other private practitioners who have felt this impact of the pandemic, I think maybe even more so than we have at the clinic. So this is just a snapshot of one clinic within the community. So prior to the pandemic, like I said before, we did not have teletherapy. We had paper and pen paperwork. We were in person only, and cash and check. Okay, so we had some session remission, and we had already kind of turned our focus towards additional trauma training for students due to the trauma need that we identified, or due to the client need that we identified in the clinic. So shortly after I arrived in 2016, I looked at some of the client needs in the clinic and found that even though, the clinic is, really supports relational needs, couples therapy, family therapy. We do individual therapy as well, but remember, we have to make sure that the client needs don't exceed that which the therapist can deliver. And so, this, I think this information was a surprise to us that, well over 60% of the clients at the clinic had experienced a severe form of trauma in their lifetime. And so there was a focus kind of that turned to how do we make sure that students are trained to meet the client needs and to best serve the clients in the community. And so that is, we received some grants on training. We've done some training in EMDR, which is a trauma specific training, and offered additional trainings and supervision for students to be able to offer this well at the clinic. Okay. And at that time, this was in 2018, 2019, as a whole, we did about 1,150 therapy hours a year. That was about what we did. Okay. So then we shifted to include remote therapy work, right? Including teletherapy, electronic paperwork, and credit card. And we were able to see clients across the state of North Carolina. Okay, and I apologize, sorry, just 1 second. It appears that my battery, even though I thought this was plugged in, is not plugged in. So I apologize, just one second. Okay. Any questions so far about that impact or thoughts? Okay. All right, well, so here we have a chart too about our therapy hours by fiscal year. So this went from, if you see over to the left, we have 2018 to 2019. That was at about that 1150 hours per year, session hours per year. And you can see in 2019 to 2020, so from March 2020 to June 2020, that would be within the pandemic times, it actually raised by about 23.5%. So that's looking, close to 24%. So increase in the number of therapy hours done that year. And then you see up here in 2020 to 2021, an even greater increase. And so where we had about 2,400 hours of therapy. So from 2018 to 2020, the fiscal year of 2020 to 2021, that is is over a 50% increase in the number of therapy hours done in the clinic. Okay. And again, we are just a snapshot. This really amongst therapy networks and amongst professional organizations, and even if you're looking for a therapist yourself, you can, the workload on therapists has increased quite a bit. And so more people are seeking out therapy. The need has been so much greater since the pandemic in therapy hours. So any questions or thoughts on that, or?
Yeah, I have a question for you. And I'm sorry if I missed this when you talked about who has coverage at your clinic.
Sure.
But I know like in North Carolina, Blue Cross Blue Shield is covering all teachers' co-pays.
Mm-hmm.
So thinking about, is it just that demand, or is it a mix of demand and coverage that is allowing you to see this increase over time?
Oh, that is a great question. And I hope I can answer that well. So we actually, and I should have mentioned this before, but at the clinic, so because the students are not yet licensed, and so both we have maybe a few every so often PhD students that are, have been out in the workforce and then gone back to, back to get their PhDs that already have their licensure. But because of that, we are actually not able to charge insurance at the clinic. And so we, all of the copay pieces for the Blue Cross Blue Shield, which I think is an amazing that's an amazing feature. None of our clients, I would say some of our clients do have insurance, but if they are able to go elsewhere and have their copay covered, likely they are going to. What we've been seeing, so we have in the clinic, there are a lot of clients that come either because they don't have insurance or they are underinsured, they don't have maybe the mental health kind of benefit, or that it is they are not able to find a therapist that has a spot, and some just come because they prefer. We think we do offer really great services as well. So I think that some of that we might be feeling some of that overflow from Blue Cross and Blue Shield, but unfortunately with ours, system, we're not able to extend that, that benefit. But that's a great question.
Dr. Roberts?
Yeah.
Hey, it's Glenn Simpson with Vitamin Behavioral Health. I have a question for you.
Yeah.
So on your graph, is the number of therapy hours available the same during that period of time?
So the number, the number of therapy hours available. Are you asking if the number of therapists increased, or?
Yeah, or another way to look at it. Yeah. So did you have more capacity in 21 than you did say in 19? And could that explain a little bit of that increase, or is it apples to apples?
So that's a great question. As far as people power, we really did not increase. So we have the same number of, because our cohorts, our second year cohorts generally fluctuate. We actually had a smaller cohort between 2020 and 2021. We had 9 students as opposed to the general 12 students that we have. And so our capacity actually decreased for the number of people that could see clients in the clinic. So the faculty did start to see clients a bit more, and we had PhD students, but they, PhD students generally see clients a bit more. But yeah, I think that one of the pieces that we were able to offer telehealth. And so when we're able to offer telehealth, we can see clients from anywhere in North Carolina. And so, I think with the demand for therapy being so great, people were reaching out for therapy wherever they can find it.
And I know in your world, you explained about the insurance and everything, but telehealth ends up being a hot topic today, just across the board, not just telepsych like you guys do. But it looks like here between 2019 and 2021, you literally doubled your therapy hours with less staff. And that sounds like that's a testament to virtual care. And I wonder if part of your work is to turn that around in order. I think it'd be interesting for legislators or somebody that would be involved with payment for virtual care to know how having virtual access to care gets people help that wouldn't get help otherwise.
Yeah, I think that is a great idea. And I'd be happy to lend this data, to anyone who is wanting to help with that joint venture. If you want to work on that with me, be happy to.
Yeah, I'd be glad to.
Yeah. So because I think that what we have heard from clients too is from clients that maybe can't afford transportation or don't have transportation to get to the clinic, that this was a game changer for them, that they were able to connect and have, we do video sessions. And so they were able to, they have their phone, right? And they were able to do therapy, from their home or find a quiet spot even at work, like a quiet and confidential spot at work, in their car. We actually had one PhD student, and this was during stay-at-home orders, who, so he and his family, they had come out in an RV, and they were living in an RV, like a tiny home. And so for most of the stay at home, he did his sessions in his, in his car. And so, really, the students and the faculty were amazing during this whole period of time. They really understood the community and social impact that they were having. And, I think the graph doesn't show too, that the severity of what people were coming in with was so much greater and so much more complex. And even from a trauma aspect, that some things that they, even childhood traumas, just being at home and not being able to leave really sparked some things for people where it just, I think the students and the faculty really adjusted, and they gave it so much their all during this whole time. So I'm very, very proud of them. So, all right, any other questions? These are great questions or thoughts. Okay, well, I'll move on to some of the substance use data that we found, and this is from the summer of 2021. And so this is at that time, and generally the summer is a bit slower, so that's why you'll see there's only about 147 active clients, and that's really clients that are being seen week to week, so weekly clients. And I think some of the numbers are pretty staggering. So what we asked was identifying problematic drug or alcohol use. And the way that we identified this is, have you or your family member identified drug or alcohol use that is problematic, that have identified, if you have identified it yourself or your family member has. And so that number was 15.6%, which I would say for the family therapy clinic is pretty high. because on intake, what we will do is we will generally, if it is identified that there is a substance use disorder going on, we will, we will say to clients, hey, you know what, if you want to come here for couples work, family work around this, great, but we really want to send you to the experts in this. And this is where we send them out to our community partners. And we have our referrals that go out so they can seek individual work for that substance use. And then certainly we can partner kind of with that therapist to give comprehensive care. So this is 15.6% that identified this. 73.9% identified as women. 47.6% are parents. And then marijuana and alcohol use was the most prevalent. That was about 91%. And alcohol use, 88% identified as women. And then I think most staggering as far as, I do trauma research. I, kind of specialize in trauma in clinical work, but I think that the most staggering thing for me was that of that 15.6% that I had identified, that had self-identified or had a family member identify problematic drug or alcohol use, in the client, that 91.3% identified as having a history of trauma, which is kind of, I think for me as trauma researcher, like that is, it is a little bit of a no-brainer. I know that connection, but even that high of a number, I think was really staggering for me. And so, I wanted to make sure that information was identified as well. Any thoughts on this? Okay. All right. And then as far as any clinic contact information, so here is my information too. If you want to connect with me, this is my email address to make an appointment, though at the clinic. Here's the phone number and an email address to, you can, we do accept referrals over email as long as it's really just very sparse, kind of what is, just, hey, I'd like to schedule an intake, and we'll, we can get back to you to get more information. And the initial process is to do a 2-hour initial intake consult. And that's just a $20 flat fee for that. And we get you set up or refer out to somebody who can specialize in what the need is. So, all right, that's what I have got. Any
Thank
questions?
you. I was checking the chat and I didn't see anything.
Okay.
But thank you so much for presenting that information. I think it was pretty useful to kind of talk, and I can speak from a personal experience. I had 3 children under the age of 5 during the pandemic. And I think that when I started to realize that I needed to find a therapist myself to deal with that, it was extremely difficult for me to find somebody because nobody was taking clients, because so many people, the influx of new clients was just so high that a lot of people just weren't accepting clients. So
there was one private practitioner that I was trying to leave a voicemail for, and literally on her voicemail, it said, "You have reached so-and-so, and I am full, and I am no longer accepting any patients for the foreseeable future. Do not leave a voicemail. Do not call again. I will only," And so, I think it's just, I think therapists were, and still are, I think, overwhelmed. The need is so great right now.
Yeah, I agree. So, so thank you so much. If you'll stick around in case there are some more questions, that would be great. In the meantime, I'm going to turn it over to Lily Malpas, who is the executive director for PCCSU, and she's going to talk a little bit about what PCCSU is doing to respond to some of the trends we're seeing in Pitt County.
Hi, thank you so much for coming, and that was really great, all of the information that you shared, Erin. So glad that you're here to speak with us. And hopefully our other guest speaker will be coming if emergencies permit, but I'm going to share my screen. So I'm just going to give some updates about what we have been doing and kind of what we're seeing. If you came to our coalition meeting in September, then you have kind of had a preview of some of the new grants that we've gotten this year. But like Dr. Matthews said, I'm Lily Malpas, the Executive Director of PCCSU, and we're doing a lot of really great things I'm excited to share with you. We really focus on awareness, prevention, and community, and most of you are already PCCSU partners and come to many of our events and are very supportive of us. But for those of you who are new, we really try to bring about a community that brings, youth to reject substance use and adults utilize low-risk choices regarding substance use. And we don't offer treatment ourselves, but we try to make sure that those in the community who may need treatment or are seeking it out know where they can get it and how to find it. So one of the biggest grants that we've got this year is the COVID-19 Supplemental Funding Grant, and it's very perfect for our speaker today, where we're working with Erin in the ECU Family Therapy Clinic to kind of address some of these needs and to offer more family support. So with this, there was a needs assessment that was being done, and we're trying to promote more family unit services and offer those into the community. And we'll be doing that in a few different ways, one of which is kind of hosting some PPP level 4 parenting practices so they can get parental support and kind of gather their skills and learn more about that. And it's really, really offering to try to prevent some of these things from developing later, for especially if they do have children. We understand that COVID is creating a lot of stressors that we just didn't know were ever going to come, and that seems to be around to stay. There'll also be a social media campaign, mainly focusing on stress and substance misuse and COVID-19 and how all of those are related. And then we'll be looking at alcohol and opioid use and alternative coping mechanisms for youth, and trying to help them learn about what is in the community that's not related to drugs and substances that can maybe offer them some of that support and get them the resources that they need. So just some short-term goals of that is our youth access campaign, and we're really focusing on locking up medicine and alcohol in the homes, family unit services, and again, the PPP level 4 that we're hoping to do. And we're just hoping that with the family and addressing the family as a whole, that long-term there'll be a prevention of substance misuse in children who have parents with a substance use disorder, and just decreasing the substance use among youth in our community. We always really focus on underage drinking as one of our big targets for the coalition. So this kind of goes hand in hand with that. And we have a couple of other grants that are also focusing on underage drinking and just youth access for some of those things. So the other grant we have is the Talk It Up, Lock It Up grant from the Vidant Community Benefits Foundation. Vidant has been a huge supporter of PCCSU in the past and just providing grants for us to do initiatives and meet the community's needs. So this is again addressing underage alcohol access at home, and we're using the Talk It Up, Lock It Up toolkit that was developed by the North Carolina Preventing Underage Drinking Initiative, or PUDI, as many of you may know. So the strategies that we have going on for that is we're working with our PCCSU youth team, which is youth team representatives from the high schools in Pitt County and the early college. So we're pretty spread out. We are thankfully are back meeting in person. COVID kind of shook us up a little. We were doing virtual, but now we're back in person. And we're really trying to focus on reaching youth in new ways. So the ways that they're communicating with each other and kind of share information, that's what we're trying to figure out so we can kind of send these messages where they need to be. There'll also be the creation of a resource toolkit for the community. And we're hoping to do a youth team PSA on alcohol access in their home. and kind of talking about parents providing alcohol for youth and opinions related to that. Recently, our youth team has started their key informant interviews, where they're going out into the community and trying to ask questions relating to alcohol. They're looking at parents, school teachers, bartenders, law enforcement, really anybody that they can think of that they've identified that they would like to kind of ask their opinions on locking up alcohol in their homes or underage drinking, or if they see issues with other underage drinking, or if they don't see issues with underage drinking. So this research will kind of address some of the questions that we want to know, and then help guide us for what the community is seeing and help us kind of plan out where we need to go in the future. The CARE grant, so Dr. Kate Egan is here as well, and she may have some more information on this, but for this, we're really focusing on prescription opioids and making sure that there is not as much access for that. So parental awareness is really big, and she is heading up a parent survey right now to talk about some of these things and to ask questions about, are parents like locking up their medicines? Is there an easy get into it? Are they using disposals? We're also trying to increase the capacity of pharmacies that are already in Pitt County to implement some of these medication disposal programs, because that's kind of what the studies and research suggests, that when it's not locked up or it's not properly disposed, that's when those who it's not intended for can start seeing access to it. So we also want to increase the number of pharmacies who are participating in the Lock Your Meds campaign, to just promote some of that information and to make sure that the people that they're seeing and those who are coming through the pharmacies are aware of these things and aware of proper medicine disposal and proper medicine, like safekeeping and safe storage practices. So those are the big things that we're doing right now, but we're doing a lot of other little things as well. We're always doing alcohol purchase surveys to look at, compliance regulations and things like that. The youth team is going to do more youth education and working in the high schools themselves about underage drinking. And we're seeing an increase in vaping. So I think that that will be a direction that we will probably start going in with the youth team as well. But that's kind of how it's related to tonight. But does anybody have any questions about our grants or kind of what we're doing right now?
Hey, did you want to add anything else for the CARE grant? I don't mean to put you on the spot, but I just figured I'd ask since you were on.
No, not right now. We're doing needs assessments and capacity assessments with pharmacies right now in the area to assess implementation and disposal programs in the future. So we do have that in the budget in future years to establish disposal boxes if they would like one. And I did see that Publix has a Lock Your Meds flyer up, and I don't think we gave it to them. So I took a photo of that. So if you see someone just taking photos of drop boxes in pharmacies, it's either myself or our lovely GA Lindsay.
Okay, I just wanted to make sure before we kind of went on. So does anybody have any questions? So I heard, the battalion chief is still tied up with an emergency. So our contact at GFR, she happens to be a former student of mine, and she worked with PICSA for a very long time. So I told her that I would follow up with her after this, and hopefully I can meet up with the battalion chief. And then what I can do is provide back the information to the people who registered for the meeting tonight, so that you can at least have some notes from that meeting and get some information from him. And then perhaps we can have him on again for another meeting. I know that he is very apologetic, but clearly can do nothing about when emergencies come through. So I definitely understand that. But we do have some time for questions. If anybody has any questions, or if there are concerns or things that are going on in Pitt County related to substance use that, PICSA should be aware of, or perhaps areas in which we haven't explored yet, then please let us know, ask us some questions, let us, so we can start to figure out what else we can do for Pitt County. I don't see any hands up.
I can ask something, Jennifer and Lily. A number of years ago, there was a big emphasis from the feds, really, to educate parents as a way of addressing prevention. Parent education was emphasized. And I remember at that time we gave out thousands of little handbooks to parents about substance use in their children and in themselves, for that matter. So what is the feeling now about the usefulness of this kind of approach? And can we use the youth team not only to reach out to their peers, but also to parents?
So I will say, from like a research standpoint, parent-child communication about substance use is an evidence-based practice. It's the research all suggests that communication is essential in either preventing youth substance use or even pushing back initiation. So instead of starting at, say, 13, they might initiate later, which then speaks to a decrease in risk for long-term issues related to substance use. So research is definitely there. I still think there's a push for that. I know that we have on our website, there is some tips for parents on how to communicate with their child about substance use. And as part of one of the DFC initiatives, I'm working with another community partner at ECU to hopefully hold it's called Teen Speak, which is an evidence-based curriculum that really trains parents on how to speak to teens or talk to teens, not just about substance use, but about any difficult topic. So whether it's sex, alcohol, drugs, substances, I mean, just any mental health issues, suicide ideation, any of that. And so, that will be one of the trainings that we hopefully partner with and offer this spring as well. So we do push pretty hard, especially as part of some of the DFC initiatives, talking to parents or talking to children, and we have resources available to do that on the website. So parents are just difficult to reach. And I hear from other organizations that try to reach parents that they're just difficult to get to. So it's kind of we do what we can. Sometimes several parents show up, sometimes none. It really is, I don't know, there's no fast and easy way. We've tried PTA meetings early on in DFC. We tried PTAs, and sometimes they would let us come in and speak. Sometimes they wouldn't. Most of the time they wouldn't. We've tried different avenues to reach parents, but they're just a difficult population to reach. So I think that what we've just decided to do is provide some information as much as we can. And there's also some digital media available on our website that is targeting parents as well. And I think one of the podcasts from Pixel also has information for parents. So we do provide it, but again, they're just a difficult population to reach. If you have any suggestions, I'll take just about anything you've got, because
I agree, it's very difficult to get parents to come to an educational program or anything of that nature. One group of parents, though, that are relatively easy to reach are those that are in treatment for their own substance use problem. Not only because the kids model what they see, but also the genetic loading that results in a high level of substance use problems among children. So That's something, that maybe we ought to do a project or work on that. How can we get counselors of all kinds who treat substance abusing adults to address the children of their clients, to give them information, advice, and so on and so forth about what their children need to avoid the consequences that they're now experiencing.
Yeah, so part of the COVID grant that Lily mentioned was the partnership with the Family Therapy Clinic. And that's really, I keep calling it our pilot to do exactly what you're talking about. So, and yes, they're not substance, the people who are in the Family Therapy Clinic are mental health clients predominantly. Yes, some of them do have substance use issues, but because of the connection, I mean, Erin and I work very closely together on lots of projects, so it was a natural collaboration. But the idea is to expand that to population. I had Port down as one of the, so any counselor, any treatment provider, and really expand to other mental health providers as well. But that, in addition to the triple P level 4, we're going to host trainings on, how trauma affects, parents and future generations, like that impact. We will have resilience trainings, because these are all resources that we have in the community. We will provide opportunities for even financial literacy. And I mean, there's just a lot of different trainings that are designed, and educational opportunities that are designed to build up the family unit to, even healthy relationships. The Teen Speak is a part of that as well, where you talk about how to talk to teens about difficult topics. But the idea is to build up the family unit as a way to prevent future substance use in any children that might be in the home, knowing that having a parent with a substance use disorder or with a mental health issue does increase that risk in the children in the home. So yeah, I mean, it's something that we are starting to do, but and that's really, I mean, I know Lily knows all about this, but that's kind of because I do a lot of work with the intersection of trauma and substance use. And so it's something I've really been pushing PCCSU to focus on. And I'm hoping that we could do more of that once we figure out how to do it in a way that is manageable, right? Like, because PCCSU is not very big right now. So we need to figure out how to use community resources and utilize some of the things that we have in Pitt County in a way that does exactly what you were talking about, David, if that makes any sense at all.
Yes, yes.
A quick question, kind of from a different space. One of the things, I'm the founder of Daughters of Worth, and in 2020 we expanded our services to now reach up to age 25. So we have a lot of girls of independence. We grew from about 7 young ladies in 2020 to over 35 currently, that we have just invested thousands and thousands of dollars, about $65,000 into shelter, healthcare, utilities, food, you name it. And in this space of serving this particular group of at-risk young ladies, and some of these are survivors of trafficking, which of course we see the intersection of substance use from that space. Some of them are transitioning out of foster care, just a variety of different situations. But my life was essentially changed about a year ago when I actually saw 2 of my girls their sweet little bodies being brought down in a white sheet pronounced DOA. And thank God both of them were able to be brought back to life through Narcan. But we are seeing substantial overdose, and it shakes you to your core when they were given a pill and split it, and did not realize that it was laced with fentanyl. And so and these are only 2 of several that we have had that have experienced these situations over the past really 2 years, but in the last year we have just seen that rise. I guess part of my question is, I feel like that we need to have more awareness, and I'm speaking me. I need more training, more access. Where is Narcan, like, other than having it for law enforcement, for having it with EMS services? Is this something that we can have available in our community? Is there funding or grant funding available to train? Because what's happening is a lot of this population, and maybe this is already happening and I'm completely unaware of it, I don't know. But for those who are in that space and they're seeing it, we've got young ladies whose parents are addicted. So they come home and mom's strung out. Do we have access for these resources to be in our community and to have to be trained, that in the event that I get a phone call, which is very possible, and I go to this girl's house and then she's laying out, and I'm just wondering if that is something that we may be interested in having, or is this already being done and I'm just not aware of it, if that makes sense.
Is it okay if I speak up?
Absolutely, Diane, go ahead.
Okay, I'm just the founder of ECM for Change, which is a syringe service program, but we also provide Narcan, both the nasal and the injectable, to community members. And I meet often with families and train them on how to use it. And I'm happy to help you if you need help.
Thank you. Yes, I would love to connect with you. Thank you.
And I will say that PICS is in the process of obtaining Narcan that we can actually give out to community members as well. I mean, I don't know when it'll actually come in. Part of PICS's delay in doing this is we're largely grant funded, and the grants that we have, you cannot purchase Narcan with. And so that's just one aspect. But I think Lily and Kate have been working on some paperwork to try to get some access to free Narcan that we can then keep in the community to distribute. And I will say, and I know this probably isn't really an avenue for the population in which you serve, Liz, but I mean, you can go to a pharmacy and buy it. But like I said, I'm very familiar with your organization, and that might not necessarily be an avenue for them, but for people that do have the means to get it, then I mean, you can get it at certain pharmacies.
And to add to that, it depends if there's health insurance. Some health insurance will cover it when you go to the pharmacy. You don't need a prescription. You don't need to be someone who uses opioids yourself. You just tell them that you want to have it in hand because someone you care about uses. And so it's another avenue as well, but I would definitely hit up Diane.
Sorry, is there a Narcan certification for administration in North Carolina? Okay, do you know that?
And that was my question, Dr. Matthews.
I'm not sure I understand the certification piece.
Hey y'all, this is Krisha. How y'all doing?
Good.
Hey, Mr. Glenn. There is since I work for drug court and I work real closely with the participants, what I can do is look into that on tomorrow for you,
okay,
and get back with you via email to let you know. Because I could get with Miss Patty, who do harm reduction in Shelby, and I could ask her, because they know a lot about, dealing with Narcan and things of that nature. And she does some other type of certifications for like substance use and peer support and stuff. So I could definitely look into that.
So I know in Virginia, our sister state, there is a certification, kind of like CPR, if you will. It's a little card. My daughter is certified in Virginia to administer Narcan, and it's but I've never seen or heard of that type of training with that little card here. So she actually carries it with her because she was given some as part of this training program. So
Glenn, you don't have to be certified in North Carolina.
Oh, you don't? Okay.
No, we,
So you don't have to be certified. I was just wondering if there was that, but you're saying, Diane, there's not that in North Carolina, but some states require you to be certified to administer? Is that what you're
right.
saying?
Yes, some states
Okay.
require, but North
So that may
Carolina.
be the case in
does-
Virginia. Okay.
Yeah, okay.
And it looks like Karen shared a resource in the chat box if you have a chance to go check that out as well.
Yeah, if you Google that, Glenn, there are several online training programs that popped up. I just put one in there just to give you an example, but it's like $25. And so you can Google search it and find some stuff. We don't offer any of those at AHEC, and I don't know of any AHEC that does. But it's a good question. I really appreciate you bringing it up.
Yeah, Pixis talked about holding some Narcan trainings. I mean, I think that actually, I remember Melissa doing one in one of our board meetings that I was there for. So that's, I know that I've seen several of them, some Narcan trainings around the state, but again, I've never heard of the certification piece in North Carolina.
So maybe Dr. Matthews, that could be something that PCCSU takes on as maybe a deliverable or a project. Not to say that you have to be certified, and I'm not so sure if that's the case in Virginia, you know, Diane or somebody else better than me, but just as Liz was saying, if there was a training course and then you have a card, I don't know, you get something, you go through the training and you get a card, and maybe there's some registry attached to that. Anyways, not to say that it needs to, but just to kind of help get more people that have that training. And then does that card, would that certification therefore get you access to so many free ones or something? I don't know, but maybe something for PCCSU to consider at some point in time.
Okay, thanks. And Diane said that she can do Narcan trainings in the community too. I'm fairly certain Diane's name was brought up as somebody who PCCSU would use to help run some of those trainings. So yeah, I mean, she's a PCCSU board member. So yeah, that's definitely something that, you know, Lily can take back to the board to talk about.
Yeah, this is Hillary. I just wanted to add, I know it's a small subgroup of the Greenville population, or maybe not so small, but a subgroup that if you ever run into ECU students who would like to access Narcan, we do have it available at the pharmacy at Student Health Services. If they go and access it, it's called a Pirate Pack. It's 2 intranasal dosages that students can obtain very discreetly, and the pharmacist goes over like a brief training on how to administer it. Certainly, we see students who carry it for potential use for someone else to use for them, but also if they do have parents or family members that they obtain it for just to have on hand.
And is that, Hillary, no cost?
Yes, sir. No cost.
Okay, good to know.
Yeah. And they can access it as often as they need to.
Yeah, I think Collegiate Recovery also has Narcan and does training.
Yeah, that's this. Yeah, the naloxone access program is kind of an idea from the Collegiate Recovery. So yeah.
Are there any other questions or comments or concerns? It's 6:35. I swore I was going to end at 6:30. So I like to make sure that we use people's, you know, if we're going to end at 6:30, that we honor that. So, and I'm 5 minutes over. So if you have any more questions or comments, please feel free to email PCCSU. Check out the website for some more information. Please see what's available there and let us know if there are services or things that your organization might could use that we could work on and partner with. So, and thank you, Lily, for putting that in the chat box. So for those of you who need it. Other than that, I mean, thank you so much for coming, and We look forward to seeing you at our next coalition meeting.
Yeah.
Have a good night, everyone.
Good
Yeah.
night.
Good night, everyone.